Hi everyone, so today we're going to be talking about mitral valve prolapse. And what is mitral valve prolapse? So mitral valve prolapse is when the mitral valve bulges or prolapses it back into the left atrium, which we're going to explain this right now. So as you can see here, we have a drawing of a heart, and to give you an idea, what you're looking at as a heart, this is the right side of the heart right here, just like this is the right side of my body, and this is the left side of the heart here, just like this is the left side of my body. If you think about it, my left arm is on my left side, even though if you look at me, it's to your right. So let's take a look at this real fast, and let's first describe how the heart works, okay? So on the top part of the heart, we have something that are called atria, or it's atrium for plural, or singular. So this is going to be my right atrium, and over here is going to be my left atrium. Now, the right atrium receives blood from the body, and the left atrium receives blood from the lungs. Down in here, we're going to have our right ventricle. And over here, we have what we call our left ventricle. Okay, so this is my left ventricle right here. And basically, what's going to happen is once these fill up with blood, they're going to contract. Now, when they contract to put blood down here in the ventricles. But if you notice these lines that are right here, that represents valves. So here's what happens. The right side, I have a valve called the tricuspid valve. It's also known as the right atrioventricular valve or the right AV valve. On the left side, I have a valve that's known as the bicuspid valve or the left AV valve or the left atrioventricular valve, or in this case, the mitral valve. So it doesn't really matter what you call it, but in this case, we want to call it mitral valve because we're talking about mitral valve prolapse. So here's what happens is normally the way the valves work is like this. Like I said, the heart's going to pump, and it's going to put the top part of the heart's going to pump, and it's going to pump the blood from up here down into here. When that happens, what occurs is the valves open up. Okay, and this is exaggerated what happens, but it gives you an idea. And the blood goes down into the left ventricle. Then what's going to happen is the bottom part is going to pump the blood out. The right part's going to pump the blood over to the lungs. The left part's going to pump the blood out to the body. So right here you actually have an artery that's called the aorta, and that's going to carry the blood out to the body. Now, I'm just drawing this here. You got to realize this happens over on this side too. So when this contracts, what occurs is the valves come up and they close and they form a tight seal. So now the valves are going to close again. The reason it does this is to keep the blood from going back into the left atrium. We want the blood to go out the aorta and to the body, right? So we want it to go out this way, right? So now, that's how it normally works. So just to give you an idea, once again, this is going to, get over here, this is going to open when the top beats and then close, open, close, open, close. In mitral valve prolapse, here's what's going to happen. We're going to change the way these look real quick to be just a little bit more accurate. And basically, these are the valves. This is obviously the valves when they're closed. And then coming off the valves, I have some strings attached to this, some cords. Let's call them cords. And these cords are going to come together. And these cords attach to a muscle down here called papillary muscles. Okay, so I have papillary muscles down here on each side. These cords right here are called chordae tendineae. And here's what happens. When the valves open up when the blood's coming down, then when the left ventricle beats, what happens is the valves close, like I said, and they form a seal. These cords keep the valves from going too far up into the atria, because we don't want these to open and go like this, right? So the cords stop them. they stop the valves from going too far up into there. So here's what happens as some people get older, or if they have different conditions. What can happen is they can stretch these out. And when they stretch out now, what's going to happen is I am going to have this prolapse. And you can see the prolapse is like a bulge, right? So I still have the cords here. And sometimes what can happen is they can even bust, right? There's a condition called Marfan syndrome, which these can actually break sometimes. But in this case, let's just say it's stretched out. All right, so let me just draw this back here because we stretched these out, right? So now, when the left ventricle beats, like we saw, the blood's going to go out through the aorta, but now some of the blood is going to go back up into the left atrium due to this prolapse that's occurred in the mitral valve. When blood goes back into the left atrium, when blood goes the wrong way, we're going to call that mitral regurgitation. Okay, again, so mitral regurgitation means the blood is going back in the wrong direction. Now, for the most part, on most people, this is usually not a problem, and they can live a normal lifestyle without having to make any changes to their lifestyle. The bad thing is if it's bad enough, blood can start to pool in here. Okay, so this is a pool of blood. And then what happens is blood's made up of living cells, right? Blood has cells in it. The cells die, and this can actually harden. And then once it hardens, a piece of this can break off and travel in the body. It's called an embolus. And then it can travel in the body and get stuck somewhere, which is an embolism. So if it goes up to my brain, it can cause a stroke. If it goes somewhere in my heart, it can cause a heart attack. It can cause things such as that. It can also go to other organs and cause problems there. The other problem we can have is you have cells that line these valves, and they're called endothelium. And what can happen now is if these get damaged, because the blood is flowing differently now, and these are being hit differently than what they're used to, and so it can damage those, and then I can actually get scarring on this valve. And then I can actually get bacteria. I can get bacteria on the valve and cause subacute bacterial endocarditis. And so that can go on and cause problems too. So for the most part though, with mitral valve prolapse, like I said, most people never have too many problems. The other thing that can happen too is if this is real bad, what they can do is they can actually take this off and put in an artificial valve. They have an artificial valve. And then what the artificial valve does is it just opens and closes and controls the blood flow in there too. So for the most part, that is mitral valve prolapse, and thank you for watching.